As the death toll from cancer continues to decline and survivors try to get back to leading as normal a life as possible, a challenge for many is painful damage to their nerves from chemotherapy.
There are currently no really good treatments, but a new blinded study is underway at the UW, and oncologists are hoping a procedure called the Scrambler will help.
Painful chemotherapy-induced neuropathy is a big problem. It's something that affects lots of people who go through cancer treatment every year. For many of them, it limits how much treatment they can get, or it causes sometimes lifelong disabling pain after the fact. And it's particularly difficult because there haven't been any treatments that have been shown in a randomized fashion to work. Painful neuropathy does primarily affect the feet first, followed by the hands if they have it bad enough, and it does inhibit their ability to walk, inhibit their ability to work. So people who, for example, receive chemotherapy after a curative surgery may be cured from their cancer but left with disability that affects them for the rest of their life from this pain caused by the chemo.
Same sort of sensation?
Yes.
This study that we're running right now is a machine called the MC5A, otherwise known as the Scrambler, which works by telling the brain that the nerves in the feet are functioning okay, that they're normal. So they say it sends a no pain signal. Chronic painful neuropathy, you have to imagine that the disease is the nerve damage because there isn't any damage ongoing anymore. So now the pain is the disease. And we have to, in some ways, re-educate the brain that everything is okay down in the feet. And that's what this machine is trying to do. So patients are attached to a machine for 45-minute treatment. They get the treatment for 10 days, Monday through Friday.
It's all for research.
So we use sort of like electrocardiogram leads that people may be familiar with that go on your chest, but they are attached to the machine, and we place them on the legs, usually above the area of pain. And the machine then sort of is intercepting those abnormal nerve signals as they travel back to the brain. And we are currently enrolling in cohorts for a 2-week period every month. And then after that, many patients are having relief of pain that lasts for weeks, months, sometimes many months, before they might need retreatment. The literature so far when using this machine has been very impressive in terms of the pain responses that people are getting, which is one of the reasons we decided to take it to the next step and test it in a blinded fashion.